NuLease Medical Solutions in Campbellsville, Kentucky. I'm not sure, I recognize a few of you all from one of the coffee talks from Louisville. I have a few of my people here that are going to help with any questions or anything like that you have. So I'll start letting them introduce themselves.
Hello, I'm Naomi Compton. I'm the front office supervisor.
Hello, I'm Derek Bishop. I'm in business development.
And I'm Heather Barnes with grant writing.
Okay, so first what we're going to do is we're going to do just a brief slideshow. We're not going to read it. We're just going to let you go through it. Derek's going to briefly summarize it, just to give you an idea of kind of what we do, okay?
So hello again, my name is Derek. Good morning, everyone. So we're with NuLease Medical Solutions, and like she said, we're just going to go through this briefly and go through each slide, and you can kind of read it. They're kind of short, to the point. So just to give you an example of what we offer here. So moving on to the first slide, here's our mission. And as you can also see up here, our laboratory is approved by CLIA and FDA. Now our company, our laboratory is, we have 2 locations right now, one here in Campbellsville and one up in Louisville, Kentucky. And our laboratory is located there. So we do offer a 24 to 72 hour turnaround on all of our labs. So it's a little bit faster in Louisville if we have, if we're providing services right there in the area versus here in Campbellsville, because we do have someone who runs those labs up each day. So it's just a little bit longer to turn around, but we're still able to get under that 72 hour mark. Here's our goal of the company. And one thing, I've been working with this company for 3 weeks now, and it talks about our team approach. That's one thing I've seen about all of the members on this team. They're very, everyone works as a team. That's one thing that I encountered. And if anyone has any questions at any time, please feel free to stop us. Now, who should be tested and treated? So as you can see on the top for drug testing, it breaks that down, and then anyone for COVID testing. Why do we test and treat?
I'll just emphasize on the why we test and treat. If you're an employer and you have, say, 75 employees under you operating your business, and you have business machinery, things like that, especially where the OSHA safety comes in. If you have someone that has a substance abuse disorder and they are operating heavy machinery after they have used substance, that could be a big liability for your company. So what NuLease is providing is that service to test your employee and also not just test them to see if they have a problem, but to give them the treatment that they need. So you are covered as far as helping your employee, you're providing those services that they needed, and you're also making your work area safe. So that's why we not just testing with your corporation, your businesses, but we're also providing that treatment, and that's what they get. It's kind of a one-stop shop whenever they get to NuLease. So Does anybody have any questions over that?
Okay, moving on. Medical providers at NuLease. So here's a list of the providers. A psychiatrist, we actually have medical doctors specifically trained in addiction medicine. We have registered nurse practitioners, master level counselors, behavioral health specialists, licensed social workers, nurses, that's RN and LPN, medical assistants, and peer support specialists. So the drug testing offered, the witness urine test, all this is FDA approved. We also offer the definitive test, which they can read the levels of each test versus just a yes or no answer whether or not they have drugs in their system. And we see that very important in this company. And that way you can keep up with a patient to know whether or not, to read the actual levels in their system from day to day or week to week. And that way, that just keeps everyone honest. And that way there's, those tests are very accurate. So that helps us. And then the test can be performed on site or at your local NuLease facility. So by saying that, we could come out to, we go out to businesses and offer them an on-site visit. Let's just say that they have 100 employees at their facility. We have a team of people that can come out, and for instance, we can do the COVID testing on site, and it just makes it much more an efficient process doing it like that versus everyone coming into the facility. However, if you're close to the facility, of course, that would be easier for us, or maybe not. It just depends on whatever that company would prefer. We're willing to do it either way. And let's just say if you have a few trickle in later through the week that didn't make it to the on-site visit, then they could visit the facility later in the week. Any questions on that? So here's the treatment we offer at NuLease, and I'll just let you go through those. Everyone's so quiet this morning.
We're just all muted.
We haven't heard anything from anyone. We just want to make sure that we can still hear if
Yes.
anyone has a question. That's all.
Merweg, how many, I did have a question about the COVID testing. Are you finding that you're doing big groups, like maybe like GE and different things like that? Or are you just doing individuals mainly right now?
Well, it's kind of a mixture of both. So we have approached, we are doing a few large groups. So we have been out to a few companies and tested on a large scale like that, and it turned out to be very successful. And, once we get those tests, we can return the results. Like I said, if it's in the local area where our lab is, generally 24 to 48 hours. But anywhere else, we can get those results back in an email within 72 hours. And that way they know if the patient is positive or negative for COVID. And the test that we use is the PCR testing for the nasal swabs, and that is about 98% accurate. So, of course, we also offer the antibody test, which is a blood test. However, that is not as accurate, and it may not tell you whether you have the virus at the present moment. It does tell you if you've had it in the past. So we do find that the nasal swabs are much more effective.
Especially if you're having the symptoms now or you've been exposed. We want to do the nasal.
Yeah, I was just wondering, like, with all these schools having outbreaks and stuff, if that was a target as well.
Yes, ma'am.
I have a question. I noticed y'all have on here sex trafficking education and support. Do y'all work with other organizations regarding that?
I think she does. That's new to us down here in Campbellsville. Our CEO, Shannon Kells, she does mainly all that. So, I mean, I think that she has different areas. We have a brochure that talks more about that also, so.
So that part of the program is definitely under development.
Yes.
And yes, we do work with other organizations.
I was just curious. I know that's a really big problem.
I got a question. Oh, sorry. Go ahead.
That's okay. I was just going to say, I would love to have a webinar on sex trafficking in the near future.
Okay, we can get that. We can get something established for you.
Thank you.
If someone has been exposed, what is the, like, how many days is it before you start noticing symptoms that might be concerning?
That's a question for you all. You know,
It just basically depends, you know, we refer most everybody to the CDC, you know, they have certain guidelines and stuff. We tend to like to tell our patients, you know, if they've been exposed, you know, it's really, if like they've been exposed that day or whatever, if they found out someone has been tested and they were around them like the night before, we tend to, you know, they can come and be tested, but, you know, they might not have any symptoms at all. And so due to the insurance and stuff, they can be retested. So it's just based on the CDC guidelines. You know, it's different with different people, you know, so I mean, it's just up to the person, you know. We're really not supposed to tell them, oh, well, if you've been exposed, you need to come now. You know what I'm saying?
So do we have any more questions on this slide?
I do have another question. If say a business wanted you all to come out and do a group test, how busy are you all? Like if they called you today, what's the soonest you could get out there?
So what would we do? I would notify the team right away, and then whoever my contact is with the company, I would collect the data from them prior to going out to the site so that we can download all of the patient information into the computer prior, so that when we go on site, we can quickly and efficiently go through the testing of each person. So it takes roughly, it's about 4 to 5 people to go out to the site to make this happen, to do this efficiently. That's the minimal amount of people.
Okay.
While we're collecting the data, it generally takes 24 to 48 hours to collect data from an employee. Okay, so
the insurance.
and
We have to get
they have to
insurance
collect and
information.
write all the insurance, and we have to verify that insurance, and then we go from there. But we can do it the very next day, actually, if needed, no problem.
Okay, thank you.
After we collect that.
And that talks in your slides, it goes on telling what we do.
All right, moving on to the next slide. So why choose NuLease? One of the things you'll see here, we try to specialize in each patient, even if they have other underlying issues going on. Like you said, we're a one-stop shop. So if we see other issues going on with the patient, then we try to address those as well before we send those patients on their way. As you can see on down there, we are the only program offering a 24/7 access to counselors. So we actually have a 24-hour call line that is available to everyone in this program. And as far as I know, we're the only program out there that does that. So you will get a person when you call this, you will not get an answering machine. So we see that as very important to this business.
So that means one of our employees takes home a cell phone, and if we have any calls, one of us will talk to the patient, the person, and get who they need to talk to, whether it be a counselor or whoever. So
Any questions on this slide? All right, moving forward. So how does the program work? Anyone have questions on this slide? All right. How do I refer my employees? Now, one of the things this program, these type of programs are very new to people out here, especially in this area and the surrounding areas. So we're just trying to get our information out there to give people a point of contact to reach out to us if needed. So I mean, that's one of the things that's really holding us back. There's, you know, we're doing our best to advertise to reach out as best we can. Next slide. So the COVID-19 testing, we show some of the rates here. And of course, some of these rates, you know, will be reduced in larger groups.
And that all goes through insurances. If the person doesn't have insurance, we assist them. We take no cash.
Questions? Next slide. This is just a continuation of the COVID-19 testing. If you want to add anything, feel free.
So this is why it's important we obtain like the insurance information and the paperwork before we go on site to test, because this is very thorough. The vital signs and just asking the patient questions if they've been exposed or anything. You know, each person, that's going to take a few minutes between each person. So that's why it's very important for us to collect our data with the other stuff ahead of time.
And we do provide all of that to the employer via email. We send that prior to our team coming out. So they'll have that sheet so their employee can fill out their information, list their insurance information, and then they email that back to us and our team puts that in. So once we do get on site, the transition goes really quickly, so.
Okay, on to the next slide. So here's some of the testing types that we discussed earlier. And that's your antibody test, the nasal swab test.
I think it's important to remember the antibody test is just, it's going to tell you, I think Derek touched on that before, it's just going to tell you whether or not you've actually had the COVID at some point. It's not going to tell you if you have it right now. And that's where the nasal swab comes in. It's gonna tell you if you have it right now.
And I think that's what's most important. That's what the employers want to know, if you have it now. And I believe also they're looking for that accuracy. And this, like I said earlier, this is like a 98% accurate test. I have heard, you know, some other people that do what they call rapid testing. And I've also been told that that's 50 to 60% accurate. So the way I view this, I would rather get a much more accurate test and be for sure about the patient rather than do something rapid and get it in 30 minutes later and you're taking a 50-50 shot at whether or not it's accurate. So those we do not support. We only do the nasal swab test here with the highest accuracy. And our lab uses the PCR technology, which is the same equipment that the CDC uses. So I didn't want to throw that in there.
And it goes straight to our lab. It's not like other places that, you know, they send it to another lab and then I have to wait and they get all that stuff back. So, I mean, it's straight to ours, in-house, yes.
In-house lab.
So if you get COVID, can you get it again? I've heard you could not, so I was just wondering if that was true or not.
I mean, let me take my mask off a little bit. We've had a couple of people that's come in here that has had it again. So I mean, it's definitely true. You can get it again. You just have to keep. A lot of ours have actually came back and tested a few times until they got a negative.
Okay.
Next slide. So what makes our COVID-19 testing different? I think we just discussed some of this. So first of all, we do utilize professionals, as we stated earlier. We do have physicians on hand for follow-up treatments, as well as experts in our lab experts to ensure results are accurate. We triage all the individuals. So even if we go on site, we're going to do triage on each individual to ensure their temperature and oxygen levels are proper or within the range that they're supposed to be, to ensure, you know, ensure they're not sick.
Most of the people, I mean, we get our results through email. We send it to the patient. But basically, you know, a lot of the older people don't have access to email, so we do give them a call. We have a specialist that gives them a call to discuss the results and stuff with them. So, you know, because a lot of older people don't have emails, you know, so we want to make sure they know what's going on.
Any questions on this slide? And that ends the slideshow. So does anyone have any questions overall about anything else? Or would you like to go back on one of the slides to discuss anything, any of the information?